Good afternoon, everybody. So long, in the last classes, we have studied carbohydrate chemistry, and in the last class, the polysaccharides. No? So tell me one polysaccharide which human being cannot digest. Cellulose. Why cellulose cannot be digested? Due to absence of. Yes. So other polysaccharides come. Also, they are simplified to monosaccharide or they are derivatives. Okay. Now we have monosaccharides. We have in our stomach and intestine. We have monosaccharides ready for digestion. Okay. But for digestion, enzyme is required. Enzyme. No? Enzyme is required, and these enzymes, they cannot go without their friend for digestion. Their friend is co-enzymes. Co-enzymes, and these co-enzymes, they come from vitamins. These vitamins, they function in the body as co-enzymes. Along with the food, protein, carbohydrate, protein, fat, we take these vitamins also, minerals also. So our today's interest is vitamins. Now vitamins, they may be regarded as organic compounds required in diet in small amounts to perform specific biological functions for normal maintenance of optimum growth and health of the organism. Now, you have to know what are the vitamins, types of vitamins, classification I mean. They are sources, daily recommended allowance, and their biochemical function. This thing you have to know. Especially vitamin B complexes, very important for Viva, and some short notes. And what are fat-soluble vitamins? From fat-soluble vitamins, you may get long questions, short notes, and also important for Viva. Vitamin, every one of you will be asked in Viva. So, classification of vitamins. Based on the nature of solubility, vitamins can be divided into two types: fat-soluble and water-soluble. Fat-soluble vitamins, you already know. Tell me. Okay, you can see from here itself, ADEK. ADEK. And water-soluble vitamins, they can be non-B complex vitamin and vitamin B complex. You will be asked, name one water-soluble non-B complex vitamin. Now, listening to the question, many of you get nervous. Non-water-soluble vitamin B, non-vitamin B, water-soluble vitamin, that is vitamin C. Okay, only one is there, vitamin C. And others are B complex group. Again, it is divided into energy releasing and hemopoietic. Energy releasing means they take part in the metabolism of glucose for releasing energy. They are thiamine, riboflavin, niacin, pantothenic acid, pyroxine, biotin. Okay. Now, many of you remember the vitamins as B1, 2, 3, 4, 5, 6 like that. No, not that way. You should remember as their proper name. Okay. Thiamine, riboflavin, niacin, pantothenic acid, pyridoxine and vitamin B7 means biotin. Hemopoietic vitamins, folic acid and cyanocobalamin. They are hemopoietic because they help in RBC maturation and hemoglobin synthesis. Okay, so that's why they are take part in formation of blood, and that's why they are hemopoietic vitamins. Water-soluble vitamins are soluble readily in water, easily absorbed, and when given in excess amount, they are excreted in the urine. Their main function is by means of co-enzyme formation. The synthesis, co-enzyme synthesis occurs from vitamin. There are a number of vitamins, and B-complex vitamin is usually occurs as deficiency of a group of vitamins. Means isolated vitamin B1 deficiency, isolated riboflavin deficiency doesn't usually occur. Okay, because the cause of deficiency is malnutrition. So there is multiple factor which is deficient in the body along with these vitamins. Vitamin B1 or thiamine, it is heat stable and has specific coenzyme thiamine pyrophosphate, which is mostly associated with carbohydrate metabolism. It is stable in acid medium, destroyed by autoclaving, destroyed even at room temperature in alkaline medium. So while cooking food, sometimes we add sodium bicarbonate for better cooking to make the curry soft. But sodium bicarbonate, it makes the curry in alkaline medium. That destroys maximum of the vitamin. Maximum of the vitamins are destroyed. So thiamine is destroyed in alkaline medium, but it is stable in acid medium. So if you add a tomato in the curry, that will prevent destruction of this vitamin. Its chemistry is like that. It has pyrimidine ring and thiazole ring linked together by methylene bridge. There is a hydroxyl group in the thiazole ring where the esterification occurs with phosphate group and the thiamine pyrophosphate is formed. Thiamine is pyridine ring with thiazole ring, and pyrophosphate is thiamine pyrophosphate is when pyrophosphate group is attached in the hydroxyl group of thiazole ring. Now, in case of biochemical functions, it has energy production function. Pyruvate dehydrogenase enzyme utilizes this thiamine pyrophosphate. It utilizes 5 coenzymes. Pyruvate dehydrogenase. This is an enzyme complex. It uses 5 coenzymes. One of the coenzymes is thiamine pyrophosphate. It catalyzes conversion of pyruvate to acetyl-CoA. So also alpha-ketoglutarate, similar to pyruvate dehydrogenase complex, alpha-ketoglutarate dehydrogenase, conversion of alpha-ketoglutarate to succinyl-CoA in TCA cycle. Okay. Then branch chain amino acid, alpha-ketoglutarate dehydrogenase. It is also called alpha-ketoglutarate, alpha-keto acid decarboxylate, not glutarate. Alpha-keto acid dehydrogenase. and it converts to amino acid to respective keto acid. Then in transketolase reaction of HMP shunt, this thiamine pyrophosphate is required. Now it produces NADH and H plus. That requires TPP, and NADH, it goes to electron transport chain and produce ATP. 2.5 numbers of ATPs are produced. And transmission of nerve impulse. It is believed that thiamine pyrophosphate is required for synthesis of acetylcholine, and which is a neurotransmitter. So this thiamine, through its coenzyme activity, it performs energy production, helps in energy production, reactions of leading to energy production and transmission of nerve impulse by synthesizing acetylcholine. Now here is the TCA cycle. Here is in glycolysis pyruvate is produced. Now from pyruvate, with the help of pyruvate dehydrogenase, in presence of thiamine pyrophosphate, this acetyl-CoA is formed. Now this acetyl-CoA, it goes to TCA cycle, and here also in another enzyme is there, alpha-ketoglutarate dehydrogenase, using thiamine pyrophosphate and converting alpha-ketoglutarate to succinyl-CoA. Transketolase ribose phosphate is converting to glyceraldehyde 3-phosphate. This is the HMP shunt, reaction of HMP shunt. Here also TPP is required. So biochemical function, enzyme thiamine pyrophosphate or co-carboxylase is intimately connected with the energy releasing reaction of the carbohydrate metabolism. It plays important role in transmission of nerve impulse because TPP is required for acetylcholine synthesis. Dietary sources, cereals, pulses, oilseed, nuts, yeast are good sources. Thiamine is mostly concentrated in outer layer of the cereals. Say, we call it bran. In rice, in paddy, when you remove the husk, over the rice there is a coating, that is the bran. Okay? Now during milling, what they do, they used to remove this bran layer so that rice become very white and people used to buy. They like it very much, but vitamin part is removed. Okay? So milling of rice causes loss of vitamin. But when it is parboiled, this vitamin from bran part, it percolates to the center of the seed, the rice. It percolates in the center of the rice. So while there is milling, even though bran part is removed, the vitamin is not destroyed or removed. So vitamin remains inside the rice. Okay. Now, do you know what is parboiling of rice? Those who are from South Tripura side, they will know the parboiling of rice. Means the paddy, it is with husk only. The paddy is steamed in a container, steamed. Then again it is dried. Okay, with the husk only. It is dried. Then after that milling is done. So in parboiled rice, the vitamin is not lost. It remains in the spore of the rice. RDA is 1 to 1.5 milligram per day, about 0.5 milligram per kilocalorie of energy. So a person utilizing 2000 kilocalorie of energy per day will require minimum 1 milligram of thiamine. So accordingly, children will need less, pregnant women will need a bit more, lactating women and pregnant women will need more. Deficiency manifestations. So polishing of rice, it causes deficiency. Deficiency of vitamin B1 causes beriberi. The disease is called beriberi. Beriberi. It will be, you will get it as short note, beriberi. So this is the disease caused by deficiency of vitamin B1. It is characterized by weakness, constipation, nausea, mental depression, peripheral neuropathy, irritability. Okay? This part we have already told. We will pass next. Beriberi. There are three types of beriberi: wet beriberi, dry beriberi, and infantile beriberi. Another is mixed beriberi. Wet beriberi is the mainly affected organ is heart. So there will be more of accumulation of blood fluid, means water in the body. So the person will have edema. So because of this, it is called wet beriberi. There will be edema in leg, face, trunks, and serous cavities. Means chest cavity there may be edema, and in the abdominal cavity there may be ascites. Collection of fluid in the abdominal cavity is called ascites. Okay. Now there may be palpitation along with increase in systolic and decrease in diastolic pressure. Increase in systolic pressure, decrease in diastolic pressure. This pulse pressure will be increased. You will know in physiology what is pulse pressure. Dry beriberi, mainly neurological manifestation. Infantile beriberi, mothers suffering from thiamine deficiency, the child will suffer from thiamine deficiency. So he will have beriberi, and that is called infantile beriberi. This is characterized by sleeplessness, restlessness, vomiting, convulsion, bouts of screaming. These are due to the cardiac dilatation. Okay, cardiac dilation means cardiac normal size of the heart is dilated, it becomes more bigger. So mix of this wet beriberi and dry beriberi is called mixed beriberi. Wernicke-Korsakoff syndrome. This is another vitamin deficiency state. There is deficiency of vitamin thiamine along with other vitamins. Usually occurs in the alcoholics due to the malnutrition. They don't take food properly. Okay. Now disorder is known as cerebral beriberi. Mostly seen they are chronic alcoholics. Body demands thiamine increase in alcoholism due to the insufficient intake and impaired absorption. This is characterized by loss of memory, apathy, and rhythmical to and fro motion of the eyeball. Rhythmical to and fro movement of the eyeball. Automatic, they will have rhythmical to and fro movement. So from here, on this Korsakoff syndrome, you will get a case study, clinical case study. You will be given a clinical case study. A 50 years old chronic alcoholic had memory loss, confusion, muscle weakness, tingling, numbness of limb. Name the most likely vitamin deficiency. What is the RDA and source of this vitamin? What are the deficiency disorders and explain biochemical changes that take place through deficiency of this vitamin. So you need to explain here Wernicke's encephalopathy, sorry, and beriberi also. Riboflavin. Riboflavin, it has a isoalloxazine ring with ribitol, and in the carbon number 5 of ribitol, the phosphate is linked, and when it is linked, it forms the co-enzyme FMN, flavin mononucleotide. Flavin mononucleotide. Flavin mononucleotide, and So these are the coenzymes of flavin. The protein which use flavin coenzymes, they are called flavoproteins. Flavoproteins binds with the protein. Flavoprotein is a coenzyme that binds with the protein. That protein is called apoenzyme. It is non-functional part of the protein. So when coenzyme binds with protein, apoenzyme, it forms holoenzyme. Holoenzyme means the functional protein enzyme. Functional enzyme. Biochemical function, flavin through its coenzyme flavin mononucleotide and flavin adenine dinucleotide takes part in variety of cellular oxidation reduction reactions involved in carbohydrate and lipid protein metabolism and purine metabolism. Besides electron transport, in electron transport chain also it takes part. Enzymes that flavin coenzymes are called flavoprotein. Many flavoproteins contain metal ions and hence known as metalloflavins, metalloflavoproteins. Now here are the biochemical reactions which need flavin mononucleotide or dinucleotide. So carbohydrate metabolome, pyruvate dehydrogenase complex. In thiamine also we got pyruvate dehydrogenase complex. I told you 5 type of coenzymes need. So you can give this example here also. Okay, when you learn biochemical reaction, at least give an example of reaction where it is taking part. So you can use this pyruvate dehydrogenase complex, pyruvate to acetyl-CoA, alpha-ketoglutarate dehydrogenase, alpha-ketoglutarate to succinyl-CoA, succinate dehydrogenase, succinate to fumarate. All are, these two are TCA cycle reaction. Then in lipid metabolism, acyl-CoA dehydrogenase, acyl-CoA to alpha-beta unsaturated acyl-CoA. So like that, and FMN dependent reaction is L-amino acid oxidase. It catalyzes L-amino acid to alpha-keto acid and ammonia. This table is from Satyanarayana. Dietary source: milk products, meat, egg, liver, kidney are rich sources. Cereal, fruits, vegetables are fish, and fish are moderate sources. So here animal products are given first. So best source is animal products, but they are present in vegetable also. Okay, plant source also. Remember, all vitamin B complex, they are present in plant source except vitamin B12. It is not found. It is only in animal source it is found. So remember that. RDA is 1.2 to 1.7 milligram for pregnancy and lactating women. Higher dose is recommended. Dietary manifestation: cheilosis, glossitis, dermatitis. These things occur in deficiency of vitamin riboflavin. There may be nasolabial seborrhea, vascularization of cornea, scrotal dermatitis. Seborrhea means this area, nasolabial area, it is seborrheic type of, oily it will be, okay, it will be oily type of. Then as if over the skin some oil has been applied. So this is the seborrheic dermatitis. You will know it while you learn more. Vascularization cornea, there will be redness of the periphery of the cornea. Oral manifestation, glossitis, red tongue will be there. There may be loss of papilla of the tongue. This thing you will know what is papilla of the tongue afterwards. There will be chelosis. In the angle of the mouth, there will be ulcer. Here. This is the chelosis, dry, cracked lip, and this is the angular stomatitis. Angular stomatitis. Okay. See, here also angular stomatitis there. So, wherever there is chelosis, there will be angular stomatitis. Okay. This is the glossitis, shiny tongue with loss of papilla, red and shiny. We call it magenta tongue. Niacin. It is also known as pellagra preventing factor of Goldberg. Co-enzyme of niacin are synthesized by the essential amino acids tryptophan. These coenzymes are NAD, NADP, and they involve in variety of oxidation reaction. Almost all metabolic reactions are involved directly or indirectly NAD or NADP. Essential amino acid tryptophan can serve as a precursor for synthesis of nicotinamide coenzymes. See, vitamins cannot be synthesized in the body. They have to be supplemented in the food. But this niacin, it can be synthesized in the body from the amino acid tryptophan. Okay, 60 milligram of tryptophan can give 1 milligram of niacin. So, it does not fulfill the criteria to be a vitamin, but it is included in vitamin. Okay. Actually, it is not a vitamin. Some book says. Chemistry, pellagra preventing, it is chemically pyridine 3-carboxylic acid. Reactive site is C4 and N atom of the nicotinamide. Two coenzymes are NAD and NADP. Nicotinamide, adenine, dinucleotide, and so nicotinamide, adenine, dinucleotide, phosphate, NADP. So these two coenzymes, they are very important. They produce ATP in the electron transport chain, and NADP, H, it takes part in biosynthetic reaction. Say synthesis of cholesterol, synthesis of testosterone hormone, they take part. This is the niacin. From niacin, a series of reactions is there, and NAD and NADP is synthesized. See, you have noted NAD plus, NADP plus. There is a plus sign in NAD and NADP. It is because of this nitrogen atom. Here, it is in the quaternary state. Because of that, it possesses positive charge. Okay, so that's why it is always written as NADP plus or NAD plus. Here are some reactions catalyzed NAD dependent reagent. Lactate dehydrogenase converts lactate to lactic acid to pyruvate. Glycerol 3-phosphate dehydrogenase is converts 1,3-bisphosphoglycerate. It is step of glycolysis. Then pyruvate dehydrogenase, pyruvate to acetyl-CoA. So pyruvate is here also you can give this example. Alpha-Ketoglutarate dehydrogenase, alpha-ketoglutarate to succinyl-CoA. Beta-hydroxyl-CoA dehydrogenase, beta-hydroxy coenzyme A to beta-ketoacyl-CoA. Glutamate dehydrogenase, glutamate to alpha-ketoglutarate. So these are the reactions, some of the reactions which are NAD dependent. NADPH generating reaction, here NADPH is generated, produced. Glucose 6-phosphate dehydrogenase, here it is the reaction of hexose monophosphate son. Here NADPH is produced in the reaction. It is very important, NADPH, it maintains the integrity of the RBC cell membrane. You will know it afterwards. 6-phosphoglutamate dehydrogenase, this is also HMP shunt pathway reaction. Then cytoplasmic isocyclic dehydrogenase, malic enzyme, malic to pyruvate it converts. Cytoplasmic isocyclic dehydrogenase. Another is that mitochondrial isocyclic dehydrogenase. Okay. NADPH utilizing reaction, ketoacyl reductase, HMG-CoA reductase. Remember this one? If you have to give any example, give this one. HMG-CoA reductase. This is HMG-CoA to mevalonate. It is a step of cholesterol synthesis. Then folate reductase. This is a very important. This folate reductase, it converts folic acid to tetrahydrofolate. First folate to dihydrofolate, then to tetrahydrofolate. This tetrahydrofolate is coenzyme form of folic acid. Afterwards will come. Phenylalanine hydroxylase, phenylalanine to tyrosine. This phenylalanine is an amino acid. So in phenylalanine metabolism, it is used. Dietary source, rich natural source. The rich natural source of niacin is liver, yeast, whole grains, pulses like beans, peanuts. Meat, fish, egg, and vegetables are moderate source. So these examples are given later. These are a bit having a bit less amount of content of this niacin. RDA is 15 to 20 milligram. Children 10 to 15 milligram. Niacin equivalent is used sometimes while expressing RDA. One niacin equivalent is 1 milligram of niacin or 60 milligram of tryptophan. You will be asked, how much amount of tryptophan is required to give niacin and how much niacin is given. Okay, 60 milligram gives 1 milligram niacin. Deficiency manifestation, it causes the disease called pellagra. The disease involves skin, gastrointestinal tract and central nervous system. It is characterized by 3D: dermatitis, diarrhea, dementia. If not treated, then 4th D means death. Okay. So symptoms of dementia include anxiety, irritability, poor memory, insomnia. Diarrhea is loose stool with mucus and blood. Okay, they will have this type of symptom. Pellagra is frequently observed in heart-mouth disease and carcinoid syndrome. Commonly found in corn and maize eating people. Okay, In maize, the niacin remains bound and not available for biological function. And also, maize is low in tryptophan, so that conversion of tryptophan to niacin cannot occur adequately. So, in mouth also you will some signs. Red, just like before what we have seen, they will have such type of thing and more salivation. There will be profuse salivation. Pantothenic acid, vitamin B5. Pantothenic acid is also known as cheap anti-dermatitis factor or filtrate factor, is widely distributed in nature. Its coenzyme is coenzyme A. It is involved in carbohydrate metabolism, lipid metabolism and protein metabolism, acting as carrier of activated acyl or acetyl groups. Dietary source is widely distributed in plant and animal. Rich sources are egg, liver, meat, yeast, milk. Dietary intake 5 to 10 milligram is some typing problem. Dietary intake is 5 to 10 milligram. Advice for adult. Pantothenic acid, chemically it is pantothenic acid and beta-alanine linked by a NH bond. Following several reactions, it gives coenzyme A. Coenzyme A is central molecule involved in all metabolism. More than 70 enzymes dependent on coenzyme A. Serves as carrier of activated acyl or acetyl group, as coenzyme. The coenzyme is functions as coenzyme A or coenzyme A, it is written like that only. A is for acetylation. Here are some biochemical reactions. Here, when it is condensed with fatty acid, it gives acyl-CoA. When condensed with acetic acid, it gives acetyl-CoA. When succinic acid or succinate forms succinyl-CoA and HMD-CoA. So, acetyl-CoA, it is derived from pyruvate, leucine. These are the amino acids. When you go to amino acid metabolism, you will see. So, amino acid acetyl-CoA pool is getting acetyl-CoA from pyruvate, leucine and ketogenic amino acid. Then fatty acids, they are also contribute to acetyl-CoA pool. It is utilized for TCA cycle, fatty acid synthesis, cholesterol, vitamin D, steroid hormones, ketone bodies, acetylcholine, detoxification. So, this is the coenzyme A playing a role for synthesis and reaction of this molecule. Then succinyl-CoA, it is derived from alpha-ketoglutarate, methionine, threonine, isoleucine and valine following their metabolism. Odd chain fatty acid. When it is metabolized, when fatty acid is metabolized, in each reaction, 2 carbon fragment is removed as acetyl-CoA. In the lastly, as it is odd, there will be 3 carbon, propionyl-CoA. Okay. Now, propionyl-CoA, this will be converted into succinyl-CoA. So, succinyl-CoA is used in TCA cycle, gluconeogenesis, porphyrin metabolism, acetoacetate activation and detoxification. activation of molecules when fatty acid metabolism is required, then fatty acid is activated by addition of coenzyme A to fatty acyl CoA, and after that it will enter in beta oxidation. Alpha-Ketoglutarate plus coenzyme A gives succinyl CoA, is converted into succinyl CoA by alpha-ketoglutarate dehydrogenase. Pyruvate plus coenzyme AS with the help of pyruvate dehydrogenase is converted into acetyl CoA. Okay? Group transfer. Group transfer means here is choline, we synthesize acetyl choline. Now the acetyl CoA will contribute the acetyl group to the choline, so that acetyl choline is synthesized and coenzyme A it will be separated out. So enzyme is acetyl choline synthase. Acetyl CoA plus oxaloacetate will give citrate. Then succinyl CoA, acetoacetate will give acetoacetyl CoA and succinate. And enzyme is thiophorase. Now deficiency syndrome, it is burning food syndrome. Usually seen during famine, prison camps, chronic alcoholic, manifested as paresthesia and staggering gait, impaired coordination. You will not be able to walk in straight line. Burning feet is characterized by pain and numbness of the toes, sleeplessness and fatigue are the features of burning feet syndrome. You will frequently find that patient coming in the OPD, they will say that I am having burning in my foot and limbs. Okay, these are the burning feet syndrome, and along with that sleep disturbance will be there. Biotin, also called anti-egg white injury factor, vitamin B7 or vitamin H. It is sulfur containing vitamin B complex. Biotin acts as a carrier of carbon dioxide in carboxylation reaction. Dietary sources, it is widely distributed in both animal and plant food. The rich source is liver, kidney, egg yolk, milk, tomato, grains. Recommended daily dose is 20 to 30 mg per day for adult, but this vitamin is absolutely abundantly synthesized by the intestinal bacteria. So, biotin deficiency is rarely seen. Biochemical function, biotin has imidazole and thiophene rings. Thiophene ring has valeric acid side chain to bind epsilon amino group of lysine covalently to form biocytin. So biocytin is the coenzyme form, functional form of the biotin. It is carrier of carbon dioxide in carboxylation reaction such as pyruvate carboxylase, where pyruvate is converted to oxaloacetate in presence of biotin. Fatty acid synthase, acyl CoA carboxylase. Here acetyl CoA is converted into malonyl CoA. Here also biotin is required. Propionyl CoA carboxylase, propionyl to succinyl CoA. Methyl propionyl CoA carboxylase in leucine metabolism. It is required for gene expression also. It is required for regulation of cell cycle by biotinylating key nuclear proteins. Deficiency manifestations include anemia, loss of appetite, nausea, dermatitis, glossitis. Biotin's deficiency is not common since it is well distributed in the food and also supplied by the intestinal bacteria. Biotin is present in the egg yolk, and avidin, one glycoprotein avidin called avidin is present in the egg white, and this avidin it is having antibiotic activity. So if egg is taken raw, then it will inhibit this absorption of biotin from the egg also as well as in the other food. So egg should not be taken raw. It should be boiled. Once boiled, this avidin gets destroyed. Okay. Now, avidin it causes dermatitis. So, biotin is the factor required for treatment of avidin-induced dermatitis. Now, here is a case study. Mother brought a child, 4-year-old malnourished child, to hospital with complaints of loose motion, irrational behavior, means abnormal behavior, rash around the neck. Rash means there is some degree of dermatitis around the neck. Okay, around the neck. In dietary history, they are found taking predominantly jowar and maize as staple food. Dietary instruments, what they are taking, we want to, whenever the patient comes, you have to take all this history, what they are food having. Okay, so this is the dietary history. Now, question is, what is your probable diagnosis? Mention the co-enzymes of deficient compound. Explain biochemical basis of the symptoms and signs. What is the answer? What may be the answer? Can you? It's today's topics, from today's topics only. So, as suggested from history, signs and symptoms, that means the dermatitis around the neck, that is the main thing you have to take into account. Then symptoms, that the patient is probably suffering from pellagra due to niacin deficiency. The coenzyme of the niacin are NAD plus and NADP plus. In jowar, amino acid leucine is very high in content. Okay, and this leucine, it has a inhibitory action on QPRT, quinolinate phosphorylation transferase. Quinolinate phosphorylation transferase is an enzyme which is responsible for converting tryptophan to niacin. Okay, niacin from tryptophan. So, adequate niacin synthesis is inhibited. Moreover, maize. In maize, niacin remains in bound form and not available for biological activity. So, these are the reasons why the patient is having a niacin deficient state and leading to heart disease.